This year, more than 250,000 women were told, you have breast cancer. The good news is continuing advances mean more treatment options like this. Let's take a look.
The GammaPod is changing the way early-stage breast cancer is treated. This FDA-approved treatment was developed by doctors and scientists at the University of Maryland.
The research team developed GammaPod really as a response to the fact that for many women with early-stage breast cancer, they're all treated the same, whether they have a very low-risk tumor or a higher-risk tumor. But there are a lot of patients that are probably receiving more therapy than they really need. And so the GammaPod was really developed in response to this concern as a way to deliver the radiation with fewer side effects in a shorter time frame.
It's a stereotactic radiotherapy system that's the first of its kind, one that could shorten radiation treatment from weeks to days. The GammaPod's unique design delivers high-dose radiation to breast cancer tumors while minimizing damage to healthy tissue and organs like the heart and lungs.
The two most common things women experience are fatigue as well as a skin reaction. And we're seeing that women actually have less fatigue and fewer side effects, especially with the skin. So women's quality of life has been significantly improved.
Joining us via Skype is the director of the University of Maryland Medical Center Department of Radiation Oncology, Dr. Elizabeth Nichols. Also joining us is breast cancer surgeon and author of Breast, the Owner's Manual, Dr. Christy Funk. Welcome. So, Dr. Nichols, tell us what's unique about the GammaPod and how it works.
The most important thing, I think, is the fact that this was all designed for women with early stage breast cancer. There's a couple different components of the GammaPod which make it really special. One of the main things is the fact that we have an immobilization device that really keeps the breast still so it doesn't move during the treatment. As a result of these advances, the treatment's non-invasive, more effective for women with less side effects, and then I think very importantly is more convenient for women.
I mean, this sounds like this is a major advancement.
It definitely is. It's a version of accelerated partial breast radiation. So you're doing a more concentrated focus of radiation to the high-risk zone for recurrence, right? Because we know the vast majority of cancers, when they come back, are within a centimeter or two of where they were. So are you using this as a boost or as the whole treatment?
So we actually have the ability to do it in both manners. So for women who meet criteria for partial breast radiation, so again, older women with early stage tumors, estrogen receptor positive, node negative, completely removed with surgery, we can actually offer the GammaPod as the only form of radiation therapy, just like you said, as a form of partial breast treatment. However, we can also use it for any woman who's had a lumpectomy and needs a boost as part of their therapy as well, which again still overall shortens their treatment time.
In the early stage cancers, typically we'll do between 15 and 33 days of treatment, Monday through Friday, every single day, about 15, 20 minutes in and out of the place. Tell us, how much does this reduce that length of time by?
We're actually able to deliver the GammaPod treatment in 5 sessions, and we hope in the future we may even be able to deliver it in 1 session. We deliver those.
The GammaPod is a new form of radiation therapy that's used to help treat early stage breast cancer patients. So for early stage breast cancer patients, about 60% of them will end up needing radiation therapy. Some of that depends on the type of surgery that they have, but certainly for women who have a lumpectomy, which means removing the tumor plus a rim of tissue around that, adding in radiation therapy helps prevent the cancer from coming back. Inside the unit here, there's actually 25 different sources of radiation that rotate, and what that means is that when we're delivering the radiation, there's essentially an infinite number of beam paths through which the radiation can be delivered. So from any given beam path, it's a negligible amount of radiation, but it all converges onto the target. So we get a very high dose of radiation to the target with essentially no dose around that area. Traditionally, women would have to receive radiation therapy in a daily fashion for up to 5 to 6 weeks. Over the last several decades, that's shortened down to 3 to 4 weeks. And now with the GammaPod, we have the advantage of being able to complete the treatment in just potentially 5 treatments for women. In addition to that, the GammaPod delivers the radiation in a very focused way, which can lead to decreased side effects for women, both in the short term as well as potentially in the long term as well.
We will be able to get the patient through treatment very quickly and have a better quality of life. And going forward, we believe that for a lot of for a lot of breast cancer patients, probably surgery can be omitted.
So there's two ways that the GammaPod is able to deliver radiation in a very focused way. One is by actually using an immobilization device or a mold that helps keep the breast still. As a result of having that immobilization device, we can be more precise with the radiation targeting because we know that the breast isn't going to be moving with breathing patterns or if a patient fidgets on the table, for example. So being in the prone position is also an advantage for the GammaPod treatment. So in general, when women lay in the prone position, the breast falls away from the chest wall, the heart, and the lung. And so the GammaPod takes advantage of that fact in delivering the treatment in that way.
This evolution that's pioneered by the GammaPod will clearly eventually lead to, through clinical trials work, the elimination of the scalpel in the treatment of early stage breast cancer. So imagine now you have a biopsy, you have an early stage breast cancer, you come in from anywhere from 1 to 5 treatment sessions that are typically less than 30 minutes outpatient, and you're cured of your early stage breast cancer. This is the roadmap we've now created by bringing in this paradigm-changing technology known as the GammaPod.
Innovation is a non-stop process, and we will not end here. On this device, we will continue to improve. Actually, we have already a laundry list of items that we could do better, and we are going to continue to make this better.
We will now lead both a national and international consortium of early adopters of this technology and develop the clinical trials that will define and get us to that day where the treatment of early stage breast cancer will be a few treatments of GammaPod and you're cured and done.